What if I told you that the heaviness, swelling, or quiet weakness you feel in your legs each day after 60 is not just aging, but an early warning sign that your circulation is slowly failing in ways most people never notice until it's too late? Many older adults assume this is normal. They adjust their routine, sit a little longer, move a little less, and tell themselves it's just part of getting older. But in my experience working with patients over the years, that belief is exactly what allows small circulation problems to turn into something much more serious: loss of balance, increased fall risk, and a gradual loss of independence. Here's what most people don't realize. In many cases, it's not your heart causing the issue. It's not even your arteries alone. It's a small group of muscles in your legs that have quietly stopped doing their job. And when that happens, your body loses one of its most important ways to keep blood moving. In this video, I'm going to show you 5 simple, clinically recommended movements, including one essential exercise that can help restore circulation, reduce that heavy feeling, and help your legs feel stable again starting today. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Exercise number 1, seated heel raises, your second heart activation. It may surprise you to learn that one of the most powerful ways to improve circulation in your legs doesn't involve standing, walking, or any kind of strenuous effort at all. In fact, many of my older patients overlook this movement entirely because it feels almost too gentle to make a difference until they try it consistently and notice their legs begin to feel lighter, less tight, and more responsive throughout the day. Here's what's really happening inside your body. As we age, especially after 60, we tend to spend more time sitting, watching television, reading, or resting. During these long periods of sitting, the calf muscles in your lower legs become inactive. These muscles play a critical role in circulation because every time they contract, they help push blood back up toward your heart against gravity. When they stop doing that job effectively, blood can begin to pool around your ankles and lower legs. That's when you start to notice swelling, heaviness, or that dull, tired feeling by the afternoon. This simple seated heel raise is designed to gently wake up those muscles again. Sit in a firm, stable chair with your back upright but relaxed. Place both feet flat on the floor, about hip-width apart. From this position, slowly lift your heels off the ground while keeping the balls of your feet and your toes in contact with the floor. You should feel a gentle tightening in the back of your lower legs. Nothing sharp or painful, just a steady engagement. Hold that position for about 2 to 3 seconds, then slowly lower your heels back down. The key here is control, not speed. Moving slowly allows the muscles to fully contract and relax, which is exactly what helps support blood flow. If you move too quickly or bounce your heels, you lose much of the benefit. Breathe naturally as you perform the movement. Avoid holding your breath, as that can actually reduce circulation efficiency and make you feel lightheaded. If you experience mild cramping, that's often a sign the muscles are waking up after being underused. Simply reduce the height of your heel lift or take a short break before continuing. Most people can safely perform 10 to 15 repetitions, 2 or 3 times a day, especially after long periods of sitting, like after a meal or while watching TV. This exercise is especially helpful if you've noticed your legs feeling heavy at the end of the day or if you're concerned about staying mobile and independent in your own home. It's not about pushing your body, it's about reminding it how to function the way it was designed to. And once your calves start working again, something else begins to shift. Your knees and joints start to move more freely too, which brings us to the next movement most people don't realize they're missing. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. Exercise number 2, seated knee slide, restoring joint flow and circulation. There's a subtle moment many people over 60 experience but rarely talk about. The feeling that your knees are stuck or slow to respond after sitting for a while. Not painful enough to complain about, but just enough to make standing up feel uncertain. That quiet stiffness is often your body's way of telling you that circulation and joint movement aren't working together the way they used to. After the calf muscles begin to re-engage, the next step is to help blood and fluid move more freely through the joints just above them, especially the knees. This is where a simple movement like the seated knee slide becomes surprisingly powerful. Sit comfortably in a sturdy chair with your feet flat on the floor. Place your hands lightly on the sides of the chair for support. Now, slowly slide one foot backward along the floor toward the base of the chair, allowing your knee to bend naturally. Go only as far as feels comfortable. There should be no strain or forcing. Pause briefly at that position, then gently slide your foot forward again until your leg is almost straight, but not locked. As you perform this motion, you may notice a gentle sensation around the knee joint, almost like it's loosening or warming up. That's exactly what you want. This slow bending and straightening encourages the muscles and soft tissues around the knee to contract and relax in a natural rhythm. That rhythm plays a key role in helping blood continue its upward movement through the legs. For many older adults, especially those who spend long periods sitting, watching TV, reading, or using a computer, this knee movement becomes very limited throughout the day. When the joint stays in one position too long, circulation can slow down in that area, leading to stiffness, swelling below the knee, and even a sense of tightness that makes walking feel less fluid. This exercise helps restore that natural motion without putting stress on the joint. Think of it less as exercise and more as gently guiding your knee through the movement it was designed to do. To get the most benefit, move slowly and with intention. Avoid sliding your foot quickly or using momentum. The slower the motion, the more effectively the surrounding muscles engage, which is what supports circulation. Breathe normally throughout. There's no need to rush or push. If you feel discomfort in your knee, reduce the range of motion. Even a small controlled movement can be effective when done consistently. Most people do well starting with 8 to 10 repetitions on each leg, once or twice a day, especially after sitting for extended periods. Over time, many people notice that standing up feels smoother, walking feels more natural, and that lingering stiffness begins to fade. It's a quiet improvement, but an important one, because better joint movement supports better circulation, and better circulation supports your confidence in everyday movement. And once your knees begin to move more freely again, your body is ready for something many older adults avoid, but actually need the most gentle standing movement that rebuilds trust in your balance. Exercise number 3, supported weight shift, rebuilding balance and circulation together. For many adults over 60, the most unsettling part isn't pain, It's that quiet moment when you stand up and feel just a little unsure of your balance. Not enough to fall, but enough to hesitate. That hesitation matters more than most people realize because it often leads to moving less, and moving less is exactly what slows circulation over time. Once your legs have been gently reactivated through seated movements, the next step is to help your body relearn how to carry your weight safely. This is where the supported weight shift becomes incredibly valuable. Stand behind a sturdy chair or position yourself at a kitchen counter where you feel secure. Place your hands lightly on the surface, not gripping tightly, just enough to give you a sense of stability. Your feet should be about hip width apart, flat on the ground. From here, slowly shift your body weight slightly onto your right leg. You don't need to lift your left foot, just allow more pressure to move into the right side. Hold that position for a second or two, then gently return to center. Then shift your weight to the left side in the same calm, controlled way and come back again. At first, the movement may feel almost too small to matter, but what you're doing is retraining a very important function: how your body transfers weight from one leg to the other. This is something you do every time you walk, turn, or even adjust your stance while standing. When this ability becomes less smooth or less confident, circulation can become uneven, and your risk of stiffness or even falls begins to increase. This exercise helps your muscles contract rhythmically while you're standing, which supports blood flow through the legs in a natural, functional way. At the same time, it reconnects your brain and body, improving coordination and awareness of where your weight is. To do this effectively, keep your movement slow and steady. There's no need to rush or push your limits. Your upper body should stay relaxed and upright. Avoid leaning too far to one side or locking your knees. Think of your weight shifting like a gentle pendulum, moving side to side in a predictable, controlled pattern. If you ever feel unsteady, simply reduce how far you shift or place a bit more pressure through your hands for support. Over time, as your confidence improves, you may find yourself relying less on your hands and more on your legs. This movement is especially helpful if you've noticed that standing in place feels tiring, or if you feel less stable when turning or changing direction. Practicing this daily, even for just a few minutes, can quietly rebuild both circulation and confidence in ways that carry over into your everyday life. And here's what many people don't expect. Once your body starts trusting its ability to stand and shift weight again, it becomes much easier to perform one of the most important movements for independence: getting up from a chair without hesitation, but only if you know how to do it the right way. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. Exercise number 4, chair assisted, sit to stand, restoring strength and circulation in real life movement. There's a moment in daily life that often reveals more about your leg strength and circulation than any medical test, and that's the simple act of standing up from a chair. If you've ever hesitated before rising, used your hands more than you used to, or felt a bit unsteady once you were upright, your body is giving you important information. This movement, when done with awareness, becomes one of the most effective ways to improve both circulation and independence after 60. Start by sitting in a sturdy chair with a firm seat. Scoot yourself slightly toward the edge so your feet can be placed flat on the floor, about hip width apart. Your feet should be positioned just a little behind your knees, not too far, just enough so that when you lean forward, your weight naturally shifts over your feet. Place your hands on the armrests or on your thighs if you need support. From here, gently lean your upper body forward, keeping your back straight but relaxed. This forward lean is important. It helps align your center of gravity so your legs can do the work instead of your lower back. Now, slowly push through your feet and begin to stand up. Take about 2 to 3 seconds to rise. You should feel your thighs, hips, and calves all working together. Once you reach a standing position, pause briefly to steady yourself. Then, just as slowly, begin to sit back down by bending your hips and knees, lowering yourself with control until you are fully seated again. The way you sit down is just as important as the way you stand up. Dropping quickly into the chair removes much of the muscle engagement and can place unnecessary strain on your joints. Moving slowly keeps your muscles active longer, which is what supports circulation. This exercise mirrors something you already do multiple times a day, but performing it with intention turns it into a powerful tool. Every repetition encourages coordinated muscle contractions that help push blood upward through your legs. Over time, this improves not just circulation, but also strength, stability, and confidence in your movements. For many older adults, the tendency is to avoid this movement when it becomes difficult, choosing to sit longer or rely heavily on arm support. But avoiding it can actually lead to further weakness and reduce circulation. The goal here is not perfection, but consistency. Start with a small number of repetitions, perhaps 5 to 8, and gradually build up as it feels easier. If your knees feel sensitive, use your hands more for support or choose a slightly higher chair. The key is to stay within a comfortable, pain-free range. This movement is especially important if you want to maintain independence in your daily life, getting up from the couch, standing from the dining table, or rising from bed in the morning. These are the moments that define how freely you can move in your own home. And once you begin to regain strength and control in this everyday motion, your body becomes ready for something even more powerful. A single flowing movement that ties everything together and supports circulation in the most natural way possible. Exercise number 5, controlled heel to stand flow, the one movement that brings everything together. Most people expect the most effective exercise to be the hardest one, but in reality, the movement that supports your leg circulation the most is often the one that feels the most natural. It doesn't push your body, it works with it. And when done correctly, it quietly connects everything your legs need to stay strong, steady, and well circulated after 60. This final movement builds on everything you've just practiced: your calf activation, your knee mobility, your ability to shift weight, and your strength in standing. Instead of isolating one area, it gently brings them all together into one smooth, controlled pattern your body recognizes from daily life. Begin by standing upright near a sturdy chair or kitchen counter. Keep your hands lightly resting on the surface, not gripping, just enough to feel secure. Your feet should be about hip width apart, firmly grounded. Start by slowly lifting your heels off the floor, just a small amount. You should feel your calf muscles engage, similar to the first exercise, but now in a standing position. Hold briefly at the top, then gently lower your heels back down with control. From there, without rushing, begin to bend your knees slightly, just enough to feel your hips and thighs engage, as if you were about to sit down, but not actually sitting. Then press through your feet and return to a fully upright standing position. This creates a flowing sequence: heel lift, lower, slight bend, and rise. Each part of the movement connects to the next in a calm, steady rhythm. What makes this exercise so effective is not intensity, but coordination. As your calves contract, they help push blood upward. As your knees and hips bend and straighten, larger muscle groups engage, supporting that same upward flow. When these actions happen together, circulation becomes more efficient and more consistent throughout the day. For older adults, this is especially important because many circulation issues don't come from one weak muscle, but from muscles no longer working together the way they once did. This exercise gently retrains that coordination. To perform it safely, keep your movement slow and your breathing natural. There's no need to lift your heels high or bend deeply. A small, controlled range is more than enough. If you feel unsteady, simply rely more on your hands or reduce the depth of the movement. A common mistake is turning this into a squat or rushing through the sequence. That removes the benefit and can place unnecessary strain on your joints. Instead, think of this as a practice in control and awareness, teaching your body how to move as a whole again. Many people notice that after practicing this regularly, their legs feel more responsive, standing feels more stable, and even walking becomes more fluid, not because they pushed harder, but because their body is working more efficiently. And when a single movement can improve circulation, balance, and confidence all at once, it raises an important question most people never ask. Could something this simple really be enough to change how your legs feel day to day? Protecting your circulation means protecting your independence. There comes a point in life when the body doesn't fail all at once. It changes quietly, almost politely. After 60, these changes often show up in ways that are easy to overlook. Legs that feel heavier by evening, a slower response when standing, or a subtle hesitation when walking across the room at night. None of these feel urgent, but together they tell a deeper story about circulation, strength, and how well your body is still working for you behind the scenes. What you've seen in these exercises is not just a routine, it's a reminder that your body still has the ability to respond, adapt, and improve when given the right signals. Not through force, not through intense effort, but through consistent, thoughtful movement. Circulation in the legs is not just about comfort. It affects how steady you feel when you get up in the middle of the night, how confident you are walking to the kitchen, and how safely you move through your own home. Many falls don't happen because of a major accident. They happen during ordinary moments when the body isn't quite ready to respond. And here's where understanding becomes powerful. If these small signs, stiffness, swelling, heaviness, are ignored, the next 1 to 5 years can look very different. Muscles weaken gradually. Balance becomes less reliable. Movements that once felt automatic begin to require effort and caution. Over time, this can lead to reduced activity, increased dependence, and a growing fear of falling that limits your freedom more than anything else. But the opposite is also true. When you take a few minutes each day to activate your muscles, to move your joints, and to reconnect your body's natural patterns, you begin to change that trajectory. Circulation improves. Your legs feel more responsive. Standing becomes more stable. And perhaps most importantly, your confidence returns, not because your body is younger, but because it is functioning more effectively. This is not about chasing youth, it's about preserving control. Your body at this stage of life is more sensitive, more responsive to both neglect and care. Small habits matter more now than they ever did before. The difference between ignoring these changes and addressing them early can shape how you move, live, and feel in the years ahead. So take this seriously, but not fearfully. Understand what your body is telling you, adjust how you move, and most importantly, stay involved in your own care. Because protecting your circulation today isn't just about how your legs feel now, it's about whether you'll still be able to move confidently, safely, and independently in the years to come. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.